Joining me now is Republican Congresswoman from Indiana, Victoria Spartz, who says she's a no on Speaker Johnson's budget resolution. Congresswoman, thank you so much for joining us here on Meet the Press Now. Are you still a no on this resolution, and have you talked to leadership about the package today?
Well, listen, thank you for having me. I don't change my vote if the language doesn't change, and I was very transparent and clear that this is our chance and responsibility to look all the fraud and mandatory spending, which only Congress can do, and we have a lot of fraud. You know, if you think about it, our budget in 2019 was $4.5 trillion. And now it's got $7 trillion, $2.5 trillion increase, and mainly driven by increase in healthcare. And people are not getting better healthcare, and the contrary, much worse. So we need to stop this fraud in healthcare.
And Congresswoman, you know, we've been hearing that President Trump has been speaking to some members of Congress about this package, about this framework. Have you talked to President Trump about this spending package? And if President Trump got on the phone and asked that you vote yes to move this process forward, would you still be a no?
Well, listen, on this current language, and I'd be happy to talk to President and explain that why it is important for his great policies that he tries to deliver to actually be in the law. So I'm not sure if he hears the same things from, you know, the leadership of the House, and be happy to have this discussion. We have a variety of productive discussions. We didn't talk on these issues, and I think Speaker needs to do much better job, not try to do things last second and try to jam some Republicans and have President Trump call. But I'll be happy to talk, but ultimately, you know, my position doesn't change because I understand the numbers. I actually spent over a decade, you know, in public accounting. I'm a CPA. And actually, unfortunately, I understand debits and credits, and I understand how terrible the situation, fiscal situation is, and how it can hurt the economy and a lot of American people if we don't deal with that urgently.
So to be clear, you have not yet spoken to President Trump?
Not on this issue, no.
And so if the president were to call you and twist your arm, you really would say no to the president of the United States?
Well, I don't think president actually works like that. He's a deal maker. He has discussions and he listens things. So he doesn't twist people's arms. At least I've never had him twisting my arm. We had the productive conversations, and he agrees when you have valid objections. And I truly believe my objections are very valid. I want to make sure that policy that he got elected on actually become in the law and we deliver for the American people. So I'd be happy to talk, and I think he'll agree with me.
Now, Congresswoman, you talked about potential fraud here in the federal government. A lot of Republicans have talked about that, although there hasn't been that much evidence of widespread fraud per se. You can have the debate about waste, but where do you want to see more spending cuts specifically? Do you think cutting large amounts is possible without looking at some big entitlements like Social Security, Medicare, and Medicaid?
Well, listen, we're not even, Social Security is actually not even a part of these discussions. It will be eventually need to be, and it's not contribute to our debt, but healthcare is. And unfortunately, you know, there is, if you defrauding the federal government through mandatory spending and doing hundred billions of fraud, you know, they call it dishonest billing or overbilling. It's legalized fraud because there is no laws to stop you from doing that. And that's why a lot of large oligopoly has been creating money laundering operation and really destroying the American economy and people's fiscal health and actually people's physical health. And it's been subsidized, and it's been really protectionism was created through Affordable Care Act, so-called Obamacare, and now it's on steroids. So, I mean, if you're going to, I'll give you an example. If you buy physician practice as a large hospital, and you're going to start billing exactly for the same services, facility fees, like it's performed on the main campus location, and overbill Medicare, which costs Medicare $160 billion. Is it dishonest? If you do it intentionally, it's actually fraudulent. You know, if you are going to cook the books to show that you're non-for-profit and have a ton of profits on Wall Street and paying executives and nursing and doctors are actually getting screwed and their salaries are going down, is it not a fraud? I mean, I've been in the auditing profession for a long time. I've never seen such an abuse as is happening in healthcare now.
Well, waste is one thing, fraud is another. That's a legal term. So, but big picture here, Republicans have a narrow majority. You need almost every member on board to pass just about anything, and that might require some members to give up a little. Do you think this resolution is better than nothing?
Well, listen, like just tell me, in the legal definition, if you do something intentionally wrong, that's actually fraudulent. It's not dishonest. Fraud is when you have intent and knowledge of doing something wrong, and that's what these hospital monopolies, they know what they're doing. So it is definition, legal definition of fraud, but they were able to legalize it because, unfortunately, they lobbied this Congress so much that everyone is afraid of them. And it's about time to remember about the American people and what's happening and how we bankrupt the country and how we need to save these programs for the people we promised. We need to make sure that Medicaid is good for people with disability that we promised. We need to make sure that Medicare is good for seniors and these funds are not go bankrupt, that doctors getting paid through that fair prices so they actually be able to deliver services, not start dropping some of these programs, and we will not have good doctors coming into the profession if it continues happening. So what we need to do, we need to be not afraid of big money here. Between insurance, PBMs, big pharma, big hospitals, there is so much money funneled in Washington, D.C. We're bankrupting the country, and it's about time for us not to be afraid. But we need to make some serious moves because the country is in trouble. We'll be spending half of money soon on actually just on interest. We'll have money for nothing. So we have to be able to be an adult and have a serious conversation. And unfortunately, you know, in any negotiations, what you start is usually not the floor. It's a ceiling. And I think the ceiling has to be a little bit higher to make a difference.
And Congresswoman, before I let you go, government funding expires on March 14th. Would you support a continuing resolution to keep it from shutting down?
Well, listen, Nancy Pelosi has been very successful to continue her level of spending, you know, and her level of spending has been quite significant. You know, as you said, we baseline a lot of fraudulent COVID spending in our baselines, and everyone afraid. So we're going to see what the lay of the land and what's coming it, and, you know, it depends on the conditions. I'm not going to say something hypothetical right now. It depends what that continuing resolution is going to be doing, and be happy to talk about it later. Right now, the budget instruction, that's what's on the table, and I know what the language is. I haven't seen the language for that, so I don't want to comment.
Congresswoman Victoria Spartz of Indiana, we thank you so much for your time. Thank you for speaking with us.
Thank you for having me. Appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.